Right, multi-system trauma. Okay, multiple trauma patient. So classified as more than one serious injury. Multi-system trauma patient, one or more injuries serious enough to affect more than one body system. Teamwork, timing, and transport decision are key to proper management. I promise I will be reading better. Most critical decisions: patient priority and severity, whether to limit scene time or not, which hospital or transport method is best for your patient. Determining criteria or severity. So the psychological criteria, the altered mental status, so that GCS, our Glasgow Coma Scale, less than 14 for a head injury. Hypotension, systolic, less than 90, shock and internal bleeding. Abnormal respiratory rates, head injury or later stages of shock. Anatomic criteria: amputation proximal to wrist or ankle, so anything higher than that, farther up on the body. Pelvic fractures, open or depressed skull fractures, and paralysis. Penetrating injuries to head, neck, torso, and extremities proximal to elbow and knee. Chest wall instability or deformity. 2 or more proximal long bone fractures. Crushed, degloved, mangled, or pulseless extremity. All right. Mechanism of injury: in absence of anatomic or psychological signs, MOI considered if severe. Falls, high-risk auto crashes with intrusion, ejection from automobile, death in the same passenger compartment, vehicle, telemetry data consistent with high risk of injury. Special patients and considerations: older adults do not effectively compensate for shock. Children may benefit by transport to a pediatric specialty facility. Patients with certain conditions, if they are taking anticoagulants, and if they are pregnant. So those are things to consider. Managing your system. So a typical call: when does the EMT recognize that the patient has multiple injuries? What body systems would the EMT suspect have been affected by the patient's injuries? What is the EMT's first decision about managing those injuries? And why would you make it?
Oh, I have a question. I think I know the answer to it, but I'm not for sure. This was in the last.
All right. A typical call: what actions would you take to support the affected body systems, and what priorities would you set for this patient? Analysis of the call. The previous scenario shows an example of a patient who has critical injuries. The primary assessment reveals severe immediate threats to life that the EMT could do something about. The EMT realizes the seriousness of the patient's condition and did not delay transport. The EMT showed good judgment throughout the call. So that's kind of an analysis you want to do at the end of them. All right. General principles of multi-system trauma management. Determine roles for a multi-system trauma patient beforehand. Follow priorities determined by the primary assessment. Remember the golden hour. Need for critical trauma patients to get to surgery within 1 hour of injury, not 1 hour from when you get to the patient. So that is things why like the call time matters. So you need to know, because if we're going to like south of Kit Carson on 287, by the time the page went out, you got here, you got there, it's already been 30 minutes. So something to keep in mind. Limit scene treatment. Stabilize cervical spine, suction airway, insert oral or nasal airway, restore patent airway, ventilate with bag valve mask, administer high concentration oxygen, control breathing, restricts spinal motion. Scene safety is paramount. Ensure an open airway, perform urgent or emergency moves as necessary, and adapt to the situation. Pediatric considerations. Pediatric patients will need additional emotional support because younger patients may not understand what is occurring to them or around them. When deciding whether spinal motion restriction is necessary, many protocols add consideration of MOI. Trauma scoring. Numerical rating system for trauma. Assigns number to certain patient characteristics to create a score. Objectively describes severity. Helps determine transport to a trauma center or local hospital. Helps trauma centers evaluate the care of similar patients. So, revised trauma score, RTS. Components of it are Glasgow Coma Scale, GCS, systolic blood pressure, respiratory rate. Follow local protocols for use of the trauma scoring system. Do not let it interfere with patient care. So you are not going to be spending your time going, okay, they didn't respond correctly, that's this, to come up with a score. And once you run some of these, you'll start getting a good idea of what it is in your mind. So we can see on this graphic here, they've got the Glasgow Coma Scale. So if it's 13 to 15, your revised trauma score is a 4. So it goes all the way down. You have a deal for systolic blood pressure is above 89. Is it 75, I think? Yeah, 76 to 89, you get another score. And then your respiratory rate, where's it at? So you get a revised score to come up with that revised trauma score. But do not let it interfere with patient care. Understand it. Chapter review. Multi-system trauma is a serious condition in which 2 or more major body systems are injured or affected. Recognize multi-system trauma. Triaging properly, transporting properly, and choosing the correct destination are vital for the survival of your patient. The CDC has issued guidelines for trauma triage and transport. These are guides and should be used in conjunction with your local protocols. The revised trauma score, RTS, is one method of classifying trauma patients by severity and includes the Glasgow Coma Score, systolic blood pressure, and respiratory rate. Remember, your primary assessment should determine whether your patient is seriously injured or potentially seriously injured. Limit scene treatment to life-threatening conditions. Use patient severity, psychological criteria, anatomic criteria, and MOI to decide whether to transport to a trauma center or local hospital. Some questions. Is my patient seriously injured or potentially seriously injured? Should I expedite my scene? What is the most appropriate transport destination for my patient? All right, some critical thinking. A patient was involved in a car crash with significant intrusion into the area where the patient was sitting. The patient is alert and complains of pain in the ribs.
What is that?
The heater.
Oh.
Complains of pain in the ribs. Pulse, 96 and regular. Respirations, 30 and adequate. Blood pressure, 100 over 62. Equal and reactive. Skin is cool and dry. All right. Last slide, and that is the end of that chapter.